Hey there, this is Andy Greider, and this is Unique This Week. I'm the host and producer here, and really happy to be back on air and getting to do another show this week. Today, we have with us Lisa Brooking from HealthCode Medical. She is a former nurse, a world-class athlete, and is currently working to champion proactive and preventive health through functional medicine. She's out of gorgeous Vancouver, British Columbia, and I want to thank you for taking the time, Lisa. I'm really excited to speak with you here.
Thank you, Andy, for the invitation.
Oh, it's my pleasure. I really enjoyed our initial talk. We talked about how you kind of grew up in a small town, and everything sort of has morphed out of that connection or out of that modality and mindset and all the values it brought with you from there. Can you talk about how that's affected what you've done and how it roots you to the individual patient for what you're doing now?
Yeah, thank you. I'm very proud to be part of a small town. I think when you're growing up in a small town, you don't quite realize the impact it has. It's very much a part of my every fiber. And yeah, growing up in modest means, it was all around community and doing right by people. And we attended the local church and got to know people within our community. And it was just a wonderful upbringing and really strong value system that has then led me into nursing and really caring for patients at the bedside. And then from there, really wanting to explore, okay, well, what if I take care of more than one patient in more of an administrative role or a practice leader? And so I'm so grateful to have had a progressive career that has enabled me to keep widening my perspective and opening my perspective to just different areas of care. Acute care, specialty care, and primary care has really enabled me to see different aspects of healthcare, and then hopefully arm me with all that great experience, as well as I'm going back to get my master's degree to lead this company today.
So that is fantastic. And I love the story of how you've gotten to where you are, not just with what we were just talking about, but also, one of the things that really intrigued me, Lisa, was that you've spent a lot of time as a successful high-level athlete. You've been part of Team Canada as a distance runner. Let's talk about that for a minute and how that's something that sort of provides the blend of how you operate in your personal life as an athlete and how it meshes with the work you do today.
Oh, yes. No, I am so proud to be an athlete. It's just so much a part of who I am. And I think my parents thought they picked up the wrong baby from the hospital, because I don't come from an athletic family, but I certainly come from a hardworking family. On my father's side, came off a farm. So certainly hard work and dedication. And so I stumbled across running through my high school teacher. Had said, I think you have a bit of a gift here, and explored that gift. And it has brought me a lot of great success. So ran for the University of Windsor in my undergrad, was a nurse for many years, went back to do my master's degree, and was able to have some eligibility left. So I ran my graduate degree on a full scholarship, which I think is very rare for somebody at that time. I was in my late 20s to run for the university. And strikingly, that's when I qualified for my first national team. So I made my first national team as a senior woman in my late 20s, and so unexpectedly. But I think the common theme here is that it's, exploring, you think there's an opportunity, exploring it, and just going in with an open mind and an open heart. That certainly has given me in my career the strength and courage to leave my small town and explore going to school out of my small town, and then move out west. So it's just this having faith in the process and just, being true to who you are.
Absolutely. Now, you mentioned this earlier, you started a lot of your healthcare journey in the nursing side of things. And I know you saw a lot of things there that helped you sort of morph towards this new model that you're working in. And, let's talk a little bit about that. But then also let's go ahead and kind of dive into the differences between what your center does, a little bit about how it works approach-wise, and what that looks like for a patient, because they're so used to coming out of something you would have seen in nursing, which is sort of that passive model. I'm taking on a role of being a patient, being told what the plan is, how to do things, where they're at. And you've developed an entirely different model. And I think part of that stemmed out of what you saw as a nurse. Is that right?
Yeah, completely. We've shifted the paradigm. So I would say society as a whole, we interact with healthcare, or should we say sick care, when we're sick. So when we need support, we go to our doctor, our urgent care, our emergency rooms, and we're seeking care. And often we are a bit of a passive participant in terms of we're there and they're telling us what to do. And we're just, kind of going through the motions. Depending on how sick you are, depends on how much engagement is really there. So working at a level 1 trauma center in an ICU. So I was a critical care nurse and also floated down to emerge and worked a little bit in post-operative care. I certainly saw a theme. Folks were coming in for these issues, and we ultimately want to get them better and discharge them. And then some would be coming back again. So a great example would be in cardiac surgery ICU. So that individual is getting that bypass surgery, and now they're back for stents, and then they're back for, unplugging of the stents, which we call angioplasty. So what is really going on? Did we fix the underlying plumbing? And so for me, it's arming patients with, the knowledge and the tools and the awareness to say, you can have agency over your health. This health diagnosis doesn't need to define you. You can overcome it. And I think a lot of individuals and maybe society as a whole didn't realize that. The next generation of medicine is, uncovering, figuring it out, and then having a path forward. And that's what HealthCode very much does, is we take that early detection, which we know is life-saving, and we use functional medicine to get to that root cause. So genetically, how are you made up? Different than the next person. If you're genetically predisposed to diabetes or heart disease, that's okay. It just means we need to have you really dialed in to ensure that those genes aren't expressed.
Well, and that's one of the things that I love that, again, came out of that first conversation, is that by treating this in a style that is much more personal, functional holistic medicine type of approach versus a westernized approach where it's pigeonholing things into diagnoses. You seem to be able to help the patients focus on both the really good things that are coming out of their testings and their visits, and then dealing with the not so good. It's a whole different approach. Can we talk about that a little bit, please?
So often individuals go for their annual medical, whether it's in the public sector or they're paying for that private executive medical. It's essentially looking to see if there's anything bad, anything scary happening, any cancers, aneurysms, anything brewing. But what we do is, yes, we are looking for those, cancers, heart disease, diabetes, autoimmune disease, any signs of cognitive decline, but we're also celebrating the good things. So we're looking at the health of your body as a whole and saying, wow, for your age, you got great bones, you got a great set of lungs, you should be getting out on that field. And so we are not just exploring what is bad, we are also unveiling what is good. And I think that's exciting for patients and people to see. The patients that come here to HealthCode are wanting to just live life on their terms. And life doesn't end when you turn 35, 40, 45, 50. It just gets started. And so how can, as you're creating your wealth, maybe your kids are growing up, they've moved out of the house. Okay, now you have your wealth and you're an empty nester. Now what? It doesn't mean you want or necessarily need to wind down. You could actually ramp up and do that heli skiing you always want to do, or take advantage of those trips. And in order to do that sort of thing, and you need health on your side, you need an awareness of where your health is at, and then also unleash the energy within your body. And a part of that is our bodies are often, our energy systems are being pulled because there's underlying inflammatory in our gut. What is drawing on those energy systems and our hormones to make us feel that we aren't operating at our optimal state? So at HealthCode Medical, we are screening for early detection because we believe early is life-saving. We're optimizing any underlying conditions you may have to really, bring down those needs for medications. You only need them just here and there, not dependency on them. So what measures can we do, whether it's through lifestyle modifications, different therapies, to help really bring that body back to that ideal state? And then that third arm of it is, hey, give me your ideas. What do you want to do? Do you want to run a marathon? Do you want to just keep up with your kids? Get back out on that hockey rink? Let's give you that energy and that zest to be able to do that. And we just marry that together in one model of care.
Well, I love so many of the examples that you gave there. Let's talk about the types of folks that you would see. Are you seeing folks mostly in Canada? Mostly, or are there a lot of people coming up from the US? What types of people? You mentioned folks that are moving towards retirement. Could they be a lot younger? How does that work? And
Yes.
who do you want to talk to? Where's it ideal for you?
Yeah, great question. Well, we are here for everyone of all ages, but and we service clients across Canada and the US. Majority of our clients aren't even from British Columbia, but you don't need to twist anyone's arm to come out to beautiful Vancouver. And oftentimes they tag on a ski trip up in Whistler. And so we do service clients a lot on the East Coast. We have a lot from Ontario and New York, and then down south in Texas, and then looping around to California. And it's been through word of mouth, which is always the best way. Health is very personal. And so when you help somebody with their health where they otherwise thought there was no hope, that has an impact on them. It's a feeling. And then they want to tell their neighbors and their friends and their families. And so out of need, we now have a youth program and we have a children's program. And so we are seeing families come in, and that is really exciting. I cherish the public sector. I come from it. I want to support it so that our clients don't need to use it. So it really relieves the pressure from the public sector if there's less folks that are so dependent on it. And secondly, we have our clients that are really trying to say, I want to have agency over my health. I've gone to these 4 different places. None of it's succinct. No one's talking to one another. And so that's what also makes us different, is that concierge piece that we bring in. We are tying it all together to provide that continuity of care. We are an annual membership, but we consider ourselves like a lifetime program. If you have females, for example, maybe you're more in the family planning stages. And so women are having babies later in life. They realize they're having trouble getting pregnant. They don't want to jump to IVF. What other testing can we do to see what is ultimately driving that inability? Is it stress? Is it cortisone levels? What is it? So getting to that root cause. And then maybe it's more on the perimenopausal, menopausal. Let's hone in those hormones, level them out, and then optimize your energy. On the male side as well, maybe it's more, I'm noticing I'm gaining weight, losing my hair, things are changing, my body's aching. Well, let's look at that. So people are interacting with us different than they would with their family doctor. With your family doctor, if you have pink eye, you go see your family doctor. But most don't go to the family doctor to just say, I want to be a healthier version of myself. So that's where that can happen here. And we have a whole team to support you. Aside from coming here for your annual medical, we are able to support clients, and we've proven that through distance. So whether we're shipping those repeat blood tests or what that looks like, as well as finding therapies within their local area. So we're doing that uncovery stage here through extensive imaging and then blood testing. So that's where we're getting to that real root cause and seeing the picture of your health from within. So we're bringing in international blood testing, not just the testing that we all know that's familiar on both sides of the borders, but we're also bringing in new and emerging tests. Right. And so we have a whole suite of tests, and we have no bias towards one or the other. We definitely say this new test could provide a bit more detail than this other test that's been around for 20 years, but we can do both. And so we are a platform that brings in the best in class blood testing, imaging, diagnostics, and screening tools.
It's another thing that when we talked initially, I loved about your model is you're not married to people by contracts and by long-term commitments because you want to stay best in class. What else is on the horizon? You just mentioned some incredible pieces, and I don't want to not recognize those because they're remarkable things that you're being able to do. But is there anything you can talk about that is upcoming that is something that is going to be a highlight for 2024 for your clinic and for your system and for all the progress for your patients.
Yeah, thank you. We're really excited going into next year. My medical director has a special interest in all things around brain health. And so we're just continuing to expand upon that, whether it's Alzheimer's, early Alzheimer's, cognitive decline, those who have had many concussions over the years from those hockey injuries. And so just coming in with a bit of brain fog, maybe slow processing speed, something doesn't feel right, and get to the bottom of it to see what is driving that cognitive change. The brain is the one organ that we can't transplant, so we got to take good care of it. And so we are moving in, further moving into that brain health space in a big way. We have lots of great testing here. So when folks are coming for their annual medical, we are looking to see, what does that memory look like, processing speed. We put on a brain cap that shows waves similar to your ECG with your heart rate. And so your brain, we're looking at the brain health. We're doing imaging to see the volumetric scan. So looking at the brain from the inside. And so all things around the brain we're moving into. And then, of course, continuing to expand our testing capabilities. In the cancer, we bring circulating cancer cells, testing from overseas. We're also doing, so moving into that cancer space, continuing to expand on that. As we know, people are getting cancer younger and younger. We're now seeing an increase in cancer in the 30s for women with breast cancer. So that screening starts so early. Even if we don't see it, we could know if you're at risk for it, if you have a certain type of breast tissue. And so it's all about awareness. I'm not sure about you, but if I knew this, I would change my lifestyle. I would do maybe more testing. And that is seen in so many aspects of our life. You don't take financial advice from someone who's been bankrupt. So you would take financial advice from someone who's been successful. And so with that, arming you with short and long-term goals, just like you have advisors from a wealth management standpoint. So we see health as an asset. And in doing that, we have a proven track record, and we're bringing in testing that's going to give you details and insights into your health. And then we give you a plan throughout the year. We pivot with you if something changes. And then we have a whole team to support you in tracking that progress. That's ultimately what's going to help it be sustainable, is tracking the progress so people can see their body is getting healthier on the inside. Maybe they don't see it on the outside yet.
Right. And that's so important, because you've just covered so many pieces where you're helping them become an active participant in their own health, whether that's preventative, whether that's directly addressing something that is currently occurring, whether that's on site or whether that's being treated from afar, and working in all sorts of different modalities. I'm really impressed with what you put together there, because that's probably one of the harder things you're going to do, is work with people that are, at distance, whether it's Texas or New York or Ontario, or wherever it might happen to be. But what we kind of covered this a little bit before. You mentioned children's programs and youth programs and families coming in. When we talked originally, you talked about executives coming in, wanting to take better control of their health. Who is it that you would say is the sort of, is there an ideal, one, and then two, how would they reach out to you to find out more about what you're doing, and if it is for them? Because as you said, health is a personal journey, and it's important for them to know, that they can feel really comfortable. And I think after they watch this interview, they'll know that. But just in case they've got questions, how do they reach out to you, Lisa?
No, thank you. Great question. Our ideal client is somebody that just wants insight, answers. They want agency over their health, and they recognize they may need some help. And to what degree of support, we can offer that. And if you're somebody that thinks you'll need extra support, well, we can provide that too. And if you're somebody that's maybe open to taking some vitamins and really looking at the body holistically, you're not willing to take 5 vitamins a day, your friends will think you look sick, then we will compound it, and your own Andy's special vitamins show up every month. So we help people achieve their goals. I think there's other businesses out there that are, just kind of saying, here's what we see, good luck. And so we recognize that, that support throughout the year really helps that change happen. Our clientele are busy executives, they're entrepreneurs, they're professional sports players. There's people that are, in government, they're at the top of their game. But then there's also a growing number of individuals that come from all walks of life. And so maybe you're somebody that runs a business and you are, whether you're a farmer or, you're in a suit every day, it doesn't matter. We accept everybody as they are. We are seeing individuals that are running these companies. They've worked really hard to get to where their company is, maybe on the Fortune 500. So they're running these busy companies. They're very stressed, and they didn't take care of their health along the way. And so we're certainly seeing a strong number of those individuals that are saying, "Where can I go?" And they have disposed concierge medicine doctors in their own state and province, and they're saying, "Okay, but these doctors are maybe just giving me a script for what I want, but it's not really what I need."
Yeah.
And that's where we really just take a step back and look to see why is the body asking for uppers and downers, and why are we having these feelings of mood instability and emotional instability and overall low libido. We're just looking to see what that is. And people think it's complex and time consuming, but we wrap all that in the testing. And so our testing is personalized. We have our standardization to it, but then we're overlaying that personalization. So when you make the effort, the time and effort to come to us for your annual medical, it is completely personalized for you. And that's what's exciting, is yes, I'm getting that stress test, I'm getting that full body MRI, full body ultrasound, cognitive test, the physical, but then we are going to take you, Andy, and what is important for you. And then we're going to overlay that specialized testing so that when you arrive, it's all embedded into it. So it's a seamless experience. And then maybe year after year, it changes based on your needs. Right. And so with that, we are seeing, youth and kids, processed foods, and they're, gaining weight, and there's, some mood instabilities. And certainly our kids and youth are coming. Parents are wondering if there is something underlying this before they give their child a prescription. And they want to know, is there something I can do to help change this? Or do they need a prescription? And so our abilities to test is like nowhere else. And so we're seeing our clientele come in more families, and we love taking care of families.
Well, I'll tell you, there's so many things you're doing that are so tremendously important. Is the best way for somebody to get hold of you through the website?
Yes, I'm sorry, I forgot to answer that question. Yes, so healthcode.ca or Lisa Brooking on LinkedIn. Thank you for asking.
Awesome. Oh, you're very welcome. You're very welcome. We want to make sure people can reach out, because if they've watched this, I think, Lisa, what they're going to come to realize is what you are doing. There's nothing quite like it out there. There's a lot of, or unmatched, I should say, unrivaled. And what we have seen here in the States is, the progression. It's the slow trickle towards value-based medicine, but it's a very slow trickle. And if somebody wants to actually be taken care of in that holistic, functional way now, you're probably going to be one of the best options out there for them. I love the passion that you bring, and I want to thank you for taking the time to be a guest.
Oh, thank you so much, Andy. I appreciate the conversation.
Yeah, absolutely. So my name's Andy Greider. This is Unique This Week. It's a production of Uniqueness is Power. You can check out all of the episodes we've done at uniquenessispower.com. And I encourage you to do so. Please share this with anyone you know who cares about their health in a way that they would like to see it personalized. Maybe they're having some of the issues that Lisa talked about with their own doctor. They may want to take the next level and they take the next step. They may be moving into a new phase of life, or be stuck in a current phase of life that they want to move out of. There's all sorts of different reasons to share this. And as Lisa also intimated, health is a very personal thing. So if you know somebody who's personally struggling, really good idea to forward this episode along to them. That's what we're here for. We're trying to bring you companies that are unique, that are doing something different, something cutting edge, something blue ocean, something out there that is helpful and useful for the general populace, or for even a niche audience, whoever it happens to be. And Lisa, again, thank you. This has been a real pleasure.
Thank you so much.
Thank you. And we'll see you next week on another episode of Unique This Week. We're starting to focus in on healthcare. If you know any guests you think would be a good idea, please let us know. All right. Thanks. Have a great day.